I'm Tina Gordon. I'm the president of the Associate Alumnae of Douglas College, and I'm thrilled that we could be here today for this lecture on autism. We had someone in Carolyn Markowitz who has an extensive background in this subject, and we had Brielle LaCosta, who is new to the field and brings a lot of energy and vision to her role in working with people with autism. This is such a timely topic as we find more and more research diagnosing this disease earlier and earlier, and more programs that are addressing how to handle people at all ages who are suffering with autism. And it's programs like tonight's that really give us an opportunity to bring together students who are here at Douglas Residential College and alums. These kinds of programs are stimulating both for the people who have been associated with Douglas for many years and for the students, because they get an opportunity not only to learn about a topic of interest, but also a chance to interact with a lot of our alumni. In the Alumni Association, we put an emphasis on interacting with the students and establishing those kinds of relationships. That's what really makes being at Douglas meaningful. Douglas women are everywhere, and we know we make a difference. My name is Tina Gordon. I know that because they put it on my paper in case I had some sort of mental breakdown here. I'm the president of the board of the Associate Alumnae of Douglas College, and I'm really thrilled to welcome you to tonight's Zagoren Lecture, Autism, What the Future Holds. I can tell you that we just had a very stimulating discussion this afternoon with the students and then at dinner, and I think you're in for a really informative and interesting evening. We are delighted to welcome alumnae Carolyn Markowitz, who is the Chief Operating Officer of Eden Autism Services, which, by the way, is in Princeton, so neighbors, and Brielle LaCosta. She is Miss New Jersey International. You can spot her right away. She's the one with the tiara. And by the way, it weighs 3 pounds, and so it really is true, heavy is the head that wears the crown. Before our speakers are formally introduced, I would like you to hear from Adelaide Zagoren, whom this lecture honors. As many of you know, Adelaide was Executive Director of the Associate Alumnae of Douglas College for 26 years. Her commitment to her alma mater and to Rutgers University is significant and inspiring. Following Adelaide's remarks, Dean Jacqueline Litt will come up and introduce our speakers for the evening. Please join me in welcoming Adelaide Zagoren.
Hi everyone, it's a pleasure for me to be here tonight as I come once a year to hear these wonderful lectures. And I do have to tell you that each one seems to be better than the last, and they just keep getting better and better every year. We hear from young, or in some cases a little older alumni who have done outstanding things in their career, made major contributions to their community or wherever, and we hear how they did it and why they did it and how it's going and so forth and so on. And I expect tonight's speaker, who is sitting right next to me at dinner, and she's a charming alum, much younger than I am, and I'm looking forward to hearing from her tonight. Carol? Thank you.
And let me introduce to you now the Dean of Douglas, Jacqueline Litt, who will come up and introduce our speakers. Thank you.
Good evening, everyone. Thanks very much for coming out to, I'm sure, an exciting and timely talk. Carolyn Markowitz is, as Tina said, the Chief Operating Officer at Eden Family Services in Princeton, New Jersey. She graduated from Rutgers Prep in 1969. She then went on to receive a bachelor's in psychology from Douglas, a master's degree in special ed from Rutgers, and a second master's degree in education administration from the University of Phoenix. She holds New Jersey certifications as a teacher of the handicapped, supervisor of instruction, and principal. Carol has been with Eden Family Services since its inception in 1975 as a teacher, program supervisor and director of education. She really was ahead of her time in her interest in autism and saw as we'll talk about tonight, the growth of interest and commitment to combating and understanding the disorder since the very, very early part of her career. More recently, she has assumed the position of Chief Operating Officer. In her current position, she's responsible for the day-to-day operation of the Eden programs in New Jersey and Florida, as well as wide-ranging strategic planning and budgetary initiatives at the schools, the early intervention program, adult services program, and group homes. She conducts pre-service and in-service training at Eden for both faculty and parents. She has conducted teacher training and program consultation on a state and national level. Carol is currently also an instructor at Princeton University in the psychology department. She developed the autism program for Brick Township schools and has served on statewide steering committees for the New Jersey Department of Education to develop autism program quality indicators and to develop and monitor the state's alternate proficiency assessment. She lives in Monmouth Junction, New Jersey, with her son, a freshman at George Washington University, and her husband, Jeff, CEO of the Life Skills Resource Center and author of the Cassie O'Malley Mystery Series. That sounds intriguing, too. So, Carol, welcome.
Welcome everyone tonight. It's wonderful to see some friends in the audience as well as lots of new faces. Welcome all of you. First of all, I would like to thank Dean Litt, Ms. Adelaide Zagoren, who I had the pleasure and honor of having dinner with tonight, and the Associate Alumni of Douglas College for the opportunity to speak to you. I'd also like to extend a special thank you to Dr. Sandra Harris, who has been a friend and colleague and really an inspiration to me throughout my career. Sandy. To begin with, let me just talk a little bit about Eden Autism Services, since that's where I am now and that's what I'm doing. We serve children and adults with autism through early intervention services, school, adult day and residential services, outreach and consultation, and we have programs throughout Mercer County in New Jersey, as well as in Naples and Fort Myers, Florida. And if you need or want more information about us, the best way to get that is on our website. Okay? So, I had this daunting topic, what the future holds, and I thought the best way to approach it would be to go back in time a little bit and look at that sort of long view that I have because I've been in the field for quite some time. So the starting point for me was really in 1971. I was taking psychology classes here at Douglas. I was a psychology major. As I explained to someone before, it was because I found chemistry a little daunting, so I switched from biology to psychology. And one of my professors, who was Dr. Harris, announced a new class that they would be offering, which was field work in a new school program for children with autism. And at that time, in the early 70s, we really hadn't heard very much about autism, so I was very intrigued at the opportunity to do something that was more hands-on. So I immediately signed up for the class as soon as I could. And I spent one day a week that whole year, which ended up being my senior year, working with a girl who was 6 years old and who had autism. That was a really life-changing year for me. I found all of the psychology classes that I had gone through in my career came alive at that time. Over the course of that year, we taught this young lady to talk. She was nonverbal when we started, and she learned how to speak that year, and started with sounds and words, and that was truly, truly life-changing for me. And I knew this was something that I wanted to do from that point on. So that's really how I got my start. Since that time, which seems like yesterday, but was 38 years ago, Douglas Developmental Disabilities Center has thrived and grown as a program. contributing substantially to the literature in the field of autism, and have always been on the leading edge, providing evidence-based treatment to children and young adults with autism. They have started countless professionals, myself included, in their careers, and they've educated thousands of undergraduates over the years. I think thousands is probably right, okay? In the treatment of autism and in awareness of autism. So they've really gotten the word out in many ways. So that I really owe the whole basis of my career and where my life really took shape right here at Douglas College. So, to get back to our topic, in the past 38 to 40 years, what have we learned about autism? Let me talk about that a little bit, because we've really come a long way and we still have a long way to go. In the 70s, autism was still considered a childhood psychosis, and many children were labeled childhood schizophrenic. Adults were usually not labeled as autistic at all, and as children grew up, they were given a different label. So we didn't even really talk about or know about adults with autism during that time. During the 70s, the psychogenic hypothesis started to lose favor, and the, quote, refrigerator mother theory as a cause of autism was really debunked during that time. Numerous studies started focusing on autism as a neurological disorder, as we know it today, and we're looking to find a biological cause versus a psychological cause. And that really has been the direction of research ever since. That was the trend in the late 70s. I have a quote for you from the researcher Marion DeMeyer in 1972. She pointed out that she had noted in her observations that mothers of children with autism were no more inept than other mothers. And as a parent of a college student, I found that to be pretty funny, pretty entertaining. But that was an observation that she made, and she went on to contribute a great deal to the research in her behavioral observations. So what else have we learned in the last 40 years? We've learned that early diagnosis of autism is very possible and is very important as well. At places like Douglas and Eden, we would see kids at ages of more like 4 or 5 in the 70s. And even a decade after that, the average age of diagnosis in the United States was 6 years, which is really old by today's standards. Now we know that at 1 year, there are features like the absence of joint attention, which is shared attention between a child and an adult, the absence of a social smile, a limited range of facial expression, and hypotonia, or floppy muscle tone, can indicate that a child may be at risk. Accurate diagnosis is really possible now by 18 months, so we can get children started at a much earlier point than at that 4 or 5-year-old point that we used to. And there are implications for early diagnosis. For example, a diagnosis provides access to early intervention services and funding, which is very important and very prevalent in New Jersey in particular. And studies have demonstrated that there is significant improvement which is related to a child's age at the onset of treatment. A diagnosis helps parents to cope with the disorder and assists families in providing better care for their child, and provides a direction for parents to pursue when they're trying to obtain services. This can all help with parental stress and stressors that are on the family. So an early diagnosis is very important for all of those reasons. We also learned, as most of you are probably aware, that there are many more children with autism than we thought there were around in 1972. Many more. We used to talk about 1 in 10,000 births. Now we're talking about 1 in 150, 1 in 99 in the state of New Jersey as well. So the numbers are increasing tremendously. And why is that? And that is still something that's being discussed and debated, and we don't really have definitive answers about that. But some things are true that we do know. For example, reading, according to Lorna Wing, who is a longtime researcher and psychiatrist, there are many, many changes in the diagnostic criteria, and awareness of the disorder. And that's something that she points to as part of explaining part of the increase. There's more complete diagnosis, and there's a broader definition of autism, and that's something that Eric Fonbon has looked at. And when thinking back, all of those misdiagnosed childhood schizophrenics in the 1970s would now be included in the autism spectrum. So that's another whole group that would not have been diagnosed with autism at that time. In 1991, an educational classification for autism became the law nationally and within the state. So now for schools, there was actually a classification that represented autism diagnosis and represented placements for these kids to go. Previously, all of these children who now could have been labeled appropriately as being autistic, previously would have been labeled either emotionally disturbed, mentally retarded, neurologically impaired, or multiply handicapped. So all of those different areas now had children that were mislabeled and were now labeled with autism. So the autism category established guidelines for placement, funding, and access to resources. So I'm sure that that had also had something to do with an increase in the numbers at that time, and that was right around the early 90s that happened. Okay? We've also learned that there are adults with autism, as we did not know in the past, and they're very employable, and that they can get jobs out in the community. They do need specific skills. Among these are social skills to be successful at a job, communication skills, adaptive skills like self-care and daily living skills, and job training for specific work skills. I found a recent study of adults with autism over the age of 50, and quite honestly, it was one of the few studies that I've seen of older adults with autism. And what they found in this study was that the most significant difference between adults with autism and other adults with intellectual disabilities was the lack of adaptive skills. So those skills like self-care and safety and able to engage and work with your free time, all of those kinds of skills. So people with autism were missing some of those skills, and they aren't talking about losing the skills or a decline in these people. They're just talking about maybe they had never learned them, and that was something that was just missing. And that impacted greatly on these people's quality of life. So that just highlights the importance of teaching all of those skills so that people can be more independent and know how to take care of themselves and then go out and get work. Just like everyone else, enjoyment of and fulfillment from work is essential for quality of life and allows an individual to derive reinforcement, which will lead to better performance at work and the ability to maintain a job placement. And that's true for people with autism as well as all of the rest of us. We also learned, and this was really during the 80s, during the 1980s, that many behavioral deficits are the result of frustration from an inability to communicate, and that was very true for lots of people with autism who exhibited tantrum behavior, self-injury, or aggressive behavior. And this work was done initially by Ted Carr in the mid-80s. What he demonstrated in his research was that teaching functional equivalence can mediate these behaviors, and that maladaptive behaviors can be replaced largely by communication skills. In addition, stereotypies and other maladaptive behaviors can be the result of a lack of adaptive skills or communication skills. So teaching communication, which serves as a functional equivalent, will help to decrease maladaptive behavior just by itself. So just through teaching, we can improve behavior and decrease behavior problems. Now there's a large body of work in this area. The research has been replicated many, many times, and this has led to an implementation on a regular basis in programs of functional assessments and a better understanding of the treatment of challenging behaviors. And I'll tell you, as a professional working at that time, this stuff was really exciting. It made sense to us. We saw it every day. But here was somebody coming in and quantifying it with research and saying, yeah, you're right. And this is the way you do it. And this is the way you improve behavior through teaching. So it was a really exciting time. That was back in the 80s. Let me, at this point, talk you through a really quick case study of one of the young men that we work with. He came into our program at age 14, it was about 5 years ago. When he entered our program, he had very few skills. He was not toilet trained yet, he was nonverbal, and he really couldn't use a communication system at all. He was pretty aggressive. He exhibited about 16 aggressive behaviors a day, and his pica rate, which is the eating of non-edibles, was at about 12 a day. So he had some really problematic and dangerous kind of behaviors. 5 years later, currently, he's 19 years old. He dresses himself. He's toilet trained. He's learned and is learning how to follow a picture schedule to organize his day. He's learned how to make choices and express his likes and dislikes and his wants and needs. He does this through a picture exchange communication system. He's still nonverbal, but now he's using a system to communicate with his teachers and his parents. And it's really very effective for him. And he can work at a task that he understands for up to 30 minutes at a time. And he's learning how to cook. He's learning how to make deli sandwiches. This guy's an all-star as far as I'm concerned. His current rates of aggression at pica are 0, and I looked back in his records to see if I could find a last occurrence, and it was at least more than 6 months ago. So he's doing really, really well. So as you can see, teaching a communication system that the person can really use, and teaching functional life skills is life-changing for our young people. And even as they get older, it still is life-changing. And you can change lives at age 20 or 30 or sometimes older as we're learning as we move forward. We have also learned that alternative or augmentative communication strategies can be taught to people with autism who are nonverbal. When I started working in this area, we didn't have, we were just talking before about how we really didn't have computers and how did we ever do papers in college without a laptop. We also didn't have access to computer technology in teaching. And now we have access to tremendous technology. So we have technology which can, in the form of handheld computers that are small and portable and can be programmed with all of the person's interests and wants and needs, and they can use that as their voice. And they take that with them. They carry it in a case, they take it with them, and that becomes their voice. And what a tremendous thing for someone who is not able to speak. So assistive technology can contribute to increases in independence and contributes to employability of people in adulthood, because all of the people around them can understand what they're trying to say. So, what does the future hold for us? Okay, I'll talk about a little bit now where we're going, and some of this, I confess, is my wish list for where I think we should be going. First of all, early diagnosis, so important. Start kids early in therapy and families with support services, and they'll thrive and they will grow, and it's just very, very important. So early diagnosis is really step one. We also need, as more and more kids are identified, we need an increased availability of high quality services in early intervention and in schools. And research has really told us what that means at this point. We have a lot of research on this. It means actively involving families, having staff who are highly trained and specialized in autism, having ongoing assessment for the child, a systematic plan for teaching, a focus on communication skills, generalization of skills, and planned transitions as children age and age out of programs. And this is from the National Research Council in 2002. They did a really nice job summarizing what went into quality programming. Other things that we need for the future: improved access to good medical care including education of doctors and the medical community, and having the medical community step up to the challenges of diagnosing and treating people who really can't report their symptoms and may be very fearful of any treatment. And that's a huge challenge medically, but it's something that we need to do more of. And the promulgation of evidence-based treatments that are backed up through research. Continued research into emerging treatment gives us the ability to refine and improve our teaching. Okay. One source for this that I had given you on the handout was the National Standards Report in 2009. They evaluated and list established and emerging treatments. And they define an emerging treatment as something that has shown promise but requires more study before we can be really confident that it's something that will work with a great number of children and adults. And some of the emerging treatments they talked about were things like exercise, peer-mediated interaction, scripting, picture exchange communication, and that's something I talked about before. We've had a great deal of success with that, but it still requires some more study. And theory of mind training, or teaching our people with autism to have a better insight into how other people see the world. And that's something that's some people are teaching now. Research into new and evidence-based treatments gives us access to teaching a greater variety of skills and also gives us new methods. So this is a really important direction for researchers to be going. And lastly, we need access to adult services for all of these children who are in schools and who are graduating from schools in the next few years and have just graduated. They need employment, they need appropriate living arrangements, and there's really thousands of children out there who are going to turn 21 and will need these services. So that's a very important area, and it's an area that I know Brielle is going to talk to you about a little bit. It's an area of interest for her. And we're going to need appropriate geriatric care for the aging population with autism. This is really the first generation of people with autism who are aging in the community. Previously, people were in state institutions and we didn't really know about them or see what happened as they aged. But now people are aging all around us in community residences, and they need access to medical tests and screenings just like everyone else. They need mammograms, they need DEXA scans, and they need access to good care for medical conditions of aging like heart disease, arthritis, osteoporosis, and cancer. So these are all things that we need to develop better treatments for our autism population. They're going to need specialized rehabilitation services and nursing care for the future. And access to day programs that specialize in geriatric and retirement kind of planning for them. And finally, we will need a continued emphasis on neurological, biomedical, and genetic research to find answers to a cause and a cure. So, in conclusion, let me say that I hope and feel that autism with its complexities will continue to be researched. And let me leave you with a quote from the neurologist Isabel Rappin, longtime researcher. "It is hoped that the future will find a better educated public and professionals who will be prepared for the illuminating findings and new ideas dependent on dazzling technological advances and rigorous research." And that is my hope for the field as well. Thank you.
Minutes to do some Q&A with Carol now, and then we'll introduce Brielle, and she'll speak a little bit as well about her work. So, sure. Thank you.
No problem. Questions? Questions? Yes.
Is there any research that says why the incidence in New Jersey is so much higher than the rest of the country?
I don't think we fully understand that. We were actually talking about that a little bit at dinner with Dr. Harris as well. Some of it is definitely the availability of services in New Jersey is tremendous. And people do move to New Jersey to get services. You know, compared to a lot of other states, there is a lot more going on and a lot of really good stuff going on in New Jersey. And I think some of it is people coming here and the increased awareness. And in New Jersey, we have, as I spoke before about how diagnosis was, you know, 6, 7, now it's coming earlier and earlier. We have terrific early intervention services in New Jersey. So I think kids are being identified earlier and more accurately as well. So not sure. A lot of the studies that looked at things like the environment are real inconclusive still. So we don't really have an answer, you know, in that sense. But there is, for example, a huge longitudinal study at Rutgers going on looking at environment and things like that, but it's not conclusive yet. Yeah.
Yes, I'm curious about the young woman with whom you worked in 1971. Have you followed up on her?
Yes, I have. Yes, I have. And she's delightful, and she's an adult now, and I actually have seen her since. She's very verbal and pretty sociable. And when I last saw her, she was still living at home with her family. She wasn't in a residential program or anything, but she's very successful. Yes, it was very gratifying to see. Yeah.
Is there an evaluative association such as Middle States that evaluates schools in terms of their mission and their accomplishments in the area of autism?
That's a terrific question. Not specifically for autism, but in special ed, there is something called NCASES. Now, I'm going to get the acronym wrong, but it's the National Commission for the Accreditation of Special Education Schools. So it's a national commission, and they will, it's similar to Middle States. They come to your facility, you do a self-study, and they do a site visit, and it's a 3-year accreditation. And I'm very proud to say that we have, we're on our 3rd accreditation through them. Eden also received a Blue Ribbon Schools Award back in '92. We were the first autism program to receive the federal Blue Ribbon Schools Award as well.
Is it possible to get the results of various schools in various states that participate in that kind of a...
Yes, if you contacted, I can give you my contact information, I can get it for you. But NAPSEC, that's the National Association of Special Ed Schools, NAPSEC, and they're down in Bethesda, Maryland, and they have lists. They have their own membership, and they know, you know, who they've accredited, so that would be one way. Yep. Yeah.
Are there enough schools around for the autistic children that have been identified? Because the ones I know are rather expensive. What happens to all the rest of the kids?
That's a great question. In New Jersey, which I talk about because I know New Jersey the best, obviously, children have the opportunity to be placed sometimes in their local school districts that may have an autism program locally, or if they don't have an autism program or it's not appropriate, they can be placed in a private, not-for-profit school like mine and like the Douglas School that I'm pointing at Sandy Seed, she's gone, but like the Douglas School or Eden. And those schools are, yes, they are expensive, but they don't cost anything to parents because local school districts place the children and transport them. And because of the federal law, there's no cost to parents. So they can have access to a free education that way, yeah. Yeah.
You mentioned biological research. Could you give us some idea of where this is now and what direction they're taking?
Certainly, and I'm not a neuroscientist, so I focus more on the clinical, but there's a lot of research now into brain biochemistry, the presence or absence of different chemicals that are maybe either in excess or missing, and there's a lot of research in genetics now, and looking at not only genetics in the sense of what is inherited, but also in the sense of mutations that occur that cause it. So there's a lot of different things going on in research, and there is no definitive answer yet as to a cause. Yes. Yeah.
I was just on the plane with people from Quest Diagnostics, and they say they have 2 genetic tests they're working on, they're almost ready. Do you know about them?
I do not, but that's exciting. And recently, and this is very recent, you know, we've had genetic tests for a long time for things like Down syndrome and for other conditions. And very recently, Rett syndrome, which is also considered part of the autism or the spectrum, has recently also been identified, not too many years ago. So there's a genetic test for that now. So it doesn't totally surprise me, and it's very exciting. Yes? Yeah.
I've recently come across the story of Temple Grandin,
Mm-hmm.
like the autistic woman, very productive in like animal
Mhm.
cultures. And in a speech, I heard that she said if she could change her autism, she wouldn't want to. She just wants people to appreciate it.
Yeah.
So I guess my question to you, in your program, do you put equal emphasis on treating the autistic community as well as awareness and appreciation to the non-autistic, the rest of the community?
That's a great question. And yeah, I think we do.
What was the question?
I'm sorry.
She asked about Temple Grandin, who some of you may know. There was a movie about her recently, and she's a published author, and she has autism. And whether we create, I guess, let me paraphrase what you said, but an understanding and appreciation for autism as well as the non-autistic. And I know that having heard Temple Grandin speak, no, I don't think she absolutely would not want to change herself, I don't think in any way. She has a great career. She's a published author. She's a scientist. She has some interesting, quirky stuff still, you know, but it's her personality. And she will say to you, you know, she spoke at our program once. We had the honor of having her. And she's fascinating to listen to because you sort of see how her mind works, and she explains it fairly well, how she thinks, and she talks about thinking in pictures versus words. And she also talked about, she had two people that she knew for a long time, and they both had blonde hair, and when they got a similar haircut, she couldn't tell them apart anymore, because that was what she was focusing on, and that was how she distinguished them from each other. So she has some of that really interesting still, you know, pieces of autism, although she's a lecturer and she travels widely. So it is a great question. Yeah.
Is sign language being used in autism? I've been aware of that.
Still is, yeah. We used to use it because we didn't have other technologies. So, you know, if you go back like to 1980, it was the avenue that we used for people who were not developing verbal language. And we knew, you know, all along, we knew that we had to give people a communication system. So if we didn't have access to technology, which we did not, we were using sign language extensively. So if you go to my program and see the guys who are, you know, 40, 45 years old, that's what they knew. They learned sign language, and they learned a lot of it. We still use some sign language with the kids. Some people do better with pictures, others are more, you know, are better with their fingers, and it depends on how what they gravitate to when they're assessed. But our teachers, because the kids are largely very visual learners, our teachers will sign receptively to the kids too, because it seems to clear up that auditory processing difficulty that they have. So we will use it receptively as well. Yep.
You spoke about the theory of mind training.
Mm-hmm.
Can you explain a little bit?
Sure. Theory of mind really refers to having a theory of what's in another person's mind. And it's really things like, it's called mind reading, but it's really reading social cues, body language, facial expression, and they're all things that our people with autism have a great deal of difficulty doing. It really results in, when we look at people's faces, we can read their emotions. It creates empathy in us and sympathy for how they're feeling. Our guys with autism have a lot of trouble with that. So it's really the idea that you're going to start trying to teach someone what it feels like to be in that other person's place or walk in their shoes a little bit. And I don't know a whole lot about it, but I imagine they start in a very concrete way in teaching, you know, when so-and-so leaves the room, and I tell you something, do they know what I just told you? And people with autism would tend to say, yeah, because they can't figure out a person's perspective, even if they aren't in the same room. It's getting that other perspective. So that's starting, people are starting to try and teach that, which is, I find, really interesting area. A lot of the research on it is being done here at Rutgers by Alan Leslie. He's doing a lot of this research. Yes?
What's the status of the theory that connected vaccinations and autism?
Yeah, it's a great question. Now that we have a lot of really large studies on it, it looks like what we had was a correlation and not a causation. That there was some correlation in time to kids being vaccinated and then starting to develop symptoms, but some of that's because that's when the symptoms would start to appear at around age 2. So the larger studies are pointing away from that as a cause. Yeah. Yeah, in the back.
Hi. What would you suggest for resources for a parent trying to educate themselves on how to deal with behavior? And also, sometimes it's hard to find resources to involve your child in sort of community and things like that. It doesn't always seem to be that kind of thing.
Yeah, that's an excellent question. One source I would give you is Autism New Jersey. I don't know if you've looked at their stuff.
Yeah.
They have a website and they have a lot of information on there and resources on there that also will sort of guide you to other resources. I can give you our website as well, Eden Services, EdenAutismServices.org. And that's another, you can also give us a call. Sometimes, depending on where you live, there will be something in the local community. We've had kids go out and play challenger baseball, for example. We have kids that joined a hockey league that was a special needs league. There's Special Olympics events, for social kind of stuff. But there's a lot out there, so yeah, I'd be happy to talk to you. Yep. Yes.
There are probably, not me, but probably a lot of young women, college students in this room right now, Douglas students who might be considering, what they want to do in their future, and maybe autism might be something that they want to do. What would you say to them to, sort of give them maybe an insider's view of what they should be doing if they want to sort of explore the field or get into the field?
That's a wonderful question. It's a great field, and Brielle's going to talk about that, I think, as well. It's a field that's just growing now. So, compared to when I entered the field, the possibilities are just huge. So if you were interested in education, in teaching students with disabilities, in preschool teaching, speech therapy is a great field and is a field where there just are not enough people out there. Occupational therapy, physical therapy, any of the medical fields are going to start relating more to people with autism, neurology, psychiatry, pediatrics, gastroenterology, you name it, they're all going to have, can have a focus on autism. So I would say, get some, which is really what I did, but get some hands-on experience. And as I said, I know Brielle's going to talk about that as well, but go out, volunteer someplace, do an internship, we have an after-school program that employs college students, something like that, and get an idea of the field for it and if it's for you, because then you can find out if it's something you're going to love doing or not, and then you can decide kind of where to go from there. But I think the sky's the limit now for young college students getting started, because the field is wide open. There are always jobs, and we had said this when we were talking to the students before. It's somewhat recession-proof, because human services, there's huge need, and there are always jobs out there. So it's an area that's expanding right now. It's a great field to get in.
Are there resources out there that could train special professionals who would focus on this area? Because we know that higher functioning children, we can teach them in regular schools. What if someone who is high functioning but yet has severe behaviors, then they are caught in between the two worlds? And what is your view in terms of, I guess, how parents or students who are aspiring to go into different fields, are there resources out there that would address that area?
Yeah, absolutely. There are professionals really who've spent their lives just working on challenging behavior, and there are a lot of them out there, and they're generating a lot of research. So that area continues to be a focus for a lot of professionals. It needs a lot more work. It is not an exact science. It's a science and an art, really, in a lot of ways. And it's something that I've devoted a lot of my life to, and you know, it continues to be a challenge. And it can affect, as you said, anyone, whether they, you know, may have pretty intact skills and intelligence, and they still may have some very severe behavior problems. So it's an area that continues to challenge all of us in the field. You know, I think at one time we started to feel like if we would just get the kids early enough in early intervention that we could, you know, have that not be as big a challenge. But that doesn't really seem to be the case. They still develop sometimes. So yeah, it's still a huge challenge. I think needs a lot more research, a lot more work. Yep.
Is there someone in particular you would recommend to?
We could certainly, she's smiling, Eden Services specializes in kids that have really severe and challenging needs to a great degree. So yeah, you could definitely look us up on the website and give us a call if that's something that you need. We do provide consultation and teacher training and those types of services. Yes, absolutely. Thank you.
I'm happy now to introduce Brielle LaCosta, who was crowned Miss New Jersey International in 2010. Through this honor and opportunity, she plans to spread autism awareness throughout New Jersey. In addition to her passion for autism, she is proud and honored to be an official spokesperson for the American Lung Association and the Luca John Foundation. She is also excited to partner up with Autism Speaks and host fundraisers to support the amazing work they do. She's clearly using her crown for good in the world. And that crown is crystal, we learned, actually. Brielle graduated from Douglas College in 2008 with a bachelor's degree in psychology, a minor in sociology, and a certificate in criminology. This past year, she has taken classes in speech-language pathology and hopes to attend William Patterson University to pursue a master's degree in speech. Her goal is to become a speech therapist for children with autism. She's now going to speak about her experiences in the field.
Hi everyone. I don't know how I'm going to follow that because I thought Carol was great. I'm your new Miss New Jersey International. You said that at National, so I just kind of felt like I had to do it again. I just want to share with you kind of where I got to the point where I wanted to work with autism, how I'm using the crown to support autism, and just what I'm doing now. So in 2008, I was getting ready to graduate Douglas, and around March, I was telling some of you before, I was like, what am I doing with this bachelor's in psychology? No idea. I'm sure a lot of seniors, you know, in college go through the same thing, where it's like, you're going to have this degree, but where do you go? So I was really torn about what to do. I was, at the time, working at Donald Trump's golf course, so I was like, do I stay here and hope something happens from this? Or do I go into psychology? It was so torn. And about a week later, the superintendent of the course came into the clubhouse, and he had a son. And, you know, you could tell off the bat something was a little wrong. And I found out he had autism. And I didn't really know anything about it, except from the little I learned in my intro classes in psych. But it was something I just felt like I really wanted to be part of. I saw how he was kind of, not ignored, but, you know, he wasn't treated the same. And I just kind of thought it was fascinating. So I did a little bit of research, and I found out, well, my bachelor's of psychology, I can use it with autism. Treatment of autism, they were hiring. So I thought, oh, what do I have to lose again? I had a little bit of experience. I knew that they trained a lot in ABA, and I applied. Thank God the director went to high school with my parents. So we had a little common ground, and I was hired. And from that point on, it was awesome. The training was unbelievable. I got to see all kinds of different behaviors, how to treat them, and just work with the families. That's one thing we did, was home programming. So we would go to the parents' house, family's house, probably about 2 to 3 times a week, and work with the children from everything from showering to riding the bus appropriately to going grocery shopping and behaving in the supermarket. Just little things that we really take for granted that these parents are scared to do with their own children. So that's when I really, fell in love with the fields of autism, and in December 2009, I was crowned Miss New Jersey International. And although it's a beauty pageant, that's not really how I see it. I was telling everyone before, when you put a crown on, people care what you have to say. It's like the shock. So that was my main focus this year. Is I work with adults with autism. I know the focus is on children nowadays, but as Carol was saying before, the need for services for adults is it's unbelievable. They're getting older, their parents can't take care of them. The wait list for group homes in New Jersey, for BCDI, it's about 3,000 kids on the list, and they just don't have anywhere to go. And imagine being in your 70s with the responsibility of an adult with autism, you fear, where will they go, what will happen to them? So that's been my mission this year, and I am now part of the Autism Speaks Committee, and I work with them. I'm also one of the chairs for Autism Speaks. And in addition to that, I've just kind of been touring the state, talking to kids, teenagers, you name it, about autism, even adults. Everyone's heard of it, and they think Rain Man. And as I was saying before, that's not the case at all. Media portrays it as, you have autism, you're brilliant, and it's, that's one side of it. There's a whole other side where these families are just going through so much. So now I work in private care, and I really like that because it's a great flexible schedule. And it's really great to be able to develop a program and see a child who starts off, maybe they can't with something. We really work a lot on ridership skills in the car. That's a big one, and parents are often trying to find a neighbor, a babysitter, anyone, just to watch their child for half an hour while they run to the store. It's little things. So I work on that a lot. So you name it, and I feel like I've worked with it. But for people just entering the field, I definitely agree it's recession-proof. There will always be a need. The rate's rising, not dropping. There will always be jobs. And what I wish I had done was, I'm trying to do that, but a master's program. When you're in a master's program, you can get your BCBI. So you'll be a board-certified behavior analyst. And that just opens so many doors. You have such flexibility. You can work at hospitals and schools. And I think it's really great if you're planning on having a family to have those nice school hours. And you just serve as the main consultant for a school or a hospital. Maybe I'll do that, we'll see. But there's also a BC ABA, and that's for people who have their bachelor's. They can take a few classes, and then they're a board-certified assistant behavior analyst. And I've noticed a lot lately that a lot of jobs would really like to see that certification. So if anyone's interested in going into the field, I strongly recommend that, as well as volunteering, interning. I know there's a lot of schools in the area who would really appreciate the help, and in return, you could really learn a lot. And then from that, something as simple as Craigslist. I know a lot of the people I work with advertise their services on there, and they're inundated with just families desperate for help. So if to be trained with autism, it really is beneficial for, I think, the rest of your life. And for parents who are kind of lost out there, one of the organizations I work with is called Empower Somerset. It's this great woman, her name's Sharon, she's great. She has a daughter with Rett syndrome. And her daughter is a twin, so one twin is normally developed, the other is Rett syndrome. And when she was diagnosed, she didn't know what to do, where to turn, so she's so funny. She partnered up with the Somerset County Board of Chosen Freeholders, and she developed this book. It's like this big, thick book. And it's for parents who have special need children. And it has everything in there, from doctors to schools to different recreational services, to, you name it, and it's in there. Because she wanted to develop something so that parents wouldn't feel lost like she did. So I strongly recommend that. It's by Empower Somerset, and it just has all these top-notch doctor services, you can come ask me about it. They're really, really great. They also partnered up with Mark Sanchez. I think him and I are going to be doing a public service announcement, so look for us on TV. But really, that's what I'm doing with autism now. And I'm so grateful for this title because, you know, people actually listen to what I have to say now, and, you know, the rate's just rising. And I think it's really important, if you know families with it, donate to anything you can. You don't know how far it goes. It's really needed. And so in conclusion, get involved with autism. Please support it. And that's all. Any questions?
Feel free to ask questions, and Brielle should stay and answer you for a few minutes.
Sure.
You're working with young adults, and I know that the youngest of children sometimes have control. I wondered if you have any instances where someone who is a young adult is, you know, causes any concern for you in terms of your safety.
Yes, that has definitely happened. You know, I think I'm not gonna pretend like it doesn't happen. You know, that's, I think, part of the side of autism that isn't really shown, is that there are some really aggressive kids out there. They're not all aggressive, but there's a lot of aggression and self-injury that goes on. One of the reasons why I left the first school I worked at was because they used a lot of like arm guards, batting gloves, which is fine, it's for their own safety, but I also think it often escalates the behavior. You know, if you see someone putting on pads to come up and talk to you, I think I'd be a little nervous too. So, you know, I think that there's a lot of different techniques in order to control that, which is what we were trained extensively on. You know, I've been scratched a few times, but that's it, nothing serious. And you know, most of the time, people think, you know, the ones who don't know much about aggression are just, gosh, they're like monsters, but that's not true. They can't communicate like we can. And I think it's often just the frustration, you know, of not being able to convey what they want, what they need. You know, they just act out in aggression. So, like Carol was saying, there's a lot of communication devices that are used. So I use a lot of picture schedules, which I think are great, as well as choice boards, so they can just point and communicate what they want. But I think as long as there's proper procedures, that aggression really shouldn't be an issue, and it will decrease. That's what I think.
All for coming. I think tonight's lecture was particularly inspiring. We had the passion and the lifetime commitment of Carol with all of her experience and her expertise, and we have the energy and the newfound passion of Brielle, who will be working with these kinds of people for, we hope, for many, many years, which is something that clearly we need with more and more cases being diagnosed. So we're very lucky to have these two people not only with us to speak, but so committed to this important field. So I hope you all learned something tonight, and I hope you'll spread the word about the services that you found out about to those who really need them. We have experts here, and I'm sure that if you want to ask them a few questions once we adjourn, they'd be happy to talk to you about it. So I thank you both for sharing your expertise, your knowledge, your passion, and your commitment with us. And I thank all the alums and friends and students who were able to join us today for this very stimulating lecture. Thank you very much.